Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Well, happy Aloha Friday. Thanks for tuning in this morning. I'm Ryan Kalei Suji, joined by Yanji Denise, and this is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. This morning, we are shifting the spotlight back on COVID-19 as it continues to make its way through our community.
That's right. School starts on Monday. There are some different protocols in place when it comes to masking indoors and quarantining. And we want to talk about all the developments with the virus and talk about boosters and whatnot. So joining us now is state epidemiologist from the Department of Health, Dr. Sarah Kemble. Dr. Kemble, thank you for being here this morning.
Thank you.
Well, let's talk about where we are with the numbers. It's so hard to really get a grasp of how prevalent COVID-19 is on our community because of the home test. Dr. Char has said it could be 5 to 6 times higher than what we're seeing in terms of case count. What is your sense of how we're doing as a community when it comes to our infection rate?
Yes, and it is true that what we see in terms of case counts now that get reported to us is only part of the whole picture. So we do know that case counts continue to be high. So I do think we need to keep on guard. At the same time, I do feel like the state is in a strong position. We're highly vaccinated. We've had really good uptake for primary series and first boosters. And so we've seen during the most recent surge that even though cases did go sky high, we're seeing less of the kinds of impacts that we saw back during Delta, which were really quite dire.
If you can talk a little bit about some of the other numbers we're seeing, and that's the death toll that we're also still being reported by the Department of Health due to COVID-19. What are you learning about these cases? And it may be surprising to some to see those numbers still at a pretty high clip. Can you explain to us what we're learning from those who are losing the battle to COVID-19 at this point?
Yes, sadly, we do continue to see deaths from COVID-19, and I think it reflects the very high burden of infection that is continuing to pass through our communities. Even though many people have mild to moderate illness, we still, in our, especially in our kupuna, may see more severe disease and even death. We've had 23 deaths reported in our last weekly death count, and many of those are fairly recent, within the last month. We are seeing that over almost 90% of our deaths are among people over the age of 50. And yet, less than 30% of people over 50 have had their second booster, and they are eligible. So I think one of the key messages is that you should be getting up to date on vaccine, check your eligibility. If you're over 50, go get that second booster now.
We always like to bring in questions and comments. David has a question just about what you were just talking about. He says, so the people dying, are they vaccinated? There is a distinction between being vaccinated and then also receiving the booster. So some of the folks who unfortunately have succumbed to the virus, they may have had those first 2 shots.
We don't get information that tells us exactly what the relationship is between each death and vaccination status. And yet, as I was saying, we do know that globally, while many of the deaths, most of the deaths are in the older age groups, we're still seeing less than 30% of those age groups having gotten their second booster. So it stands to reason that many of the deaths could have been preventable. So I think getting boosters now is a great way to protect yourself, and especially for kupuna.
And what are we seeing in terms of booster numbers here in the state? We, of course, know that it's been some time now since the booster has been available. And while the general population here in Hawaii had, the numbers were fairly good in terms of the amount of people that went out and got those first 2 shots, what are we seeing with this booster shot and the follow-up there?
I think there's a lot of people that have been less certain about what to do for the second booster and whether they should go get it now or they should wait and see what's coming out in the fall. We're hearing buzz about possible new vaccines coming out in the fall and maybe more variant-specific vaccines. So I understand why people may think that, and yet those are still in the planning phase, and we don't have dates yet for when that will happen. I'd say right now, if I was looking for maximum protection for myself, my family, and especially for Kupuna, I would go get that second booster now. Don't wait.
Let's talk a little bit about schools. I know that the Department of Health, in conjunction with the Department of Education, have changed the suggested guidelines for schools. No more mandatory masking indoors, and also the quarantine policies have changed. School starts on Monday. For those folks who aren't familiar with the new guidelines, tell us a little bit about what they are and how the Department of Health came to make those recommendations.
The biggest change is that going into this school year, we're looking at dropping a mandatory universal masking approach and moving to one of more targeted use of masking in response to specific scenarios. So an outbreak, a cluster in a particular classroom, but for general purposes, without a known exposure or outbreak, we're leaving masking up to your choice, your family's choice, for what you think is going to be best given your situation.
And so let's say that there is a case that is found in the classroom. What would then be the protocol in terms of isolation within the classroom for those students who have been exposed? What does that protocol look like, and what is that suggested recommendations moving forward?
People who are sick and diagnosed with COVID still need to isolate, and the isolation recommendations have not changed. So that's still 5 days at home and returning with a mask for days 6 to 10. For exposures that happen in school, so for instance, maybe there's a case in a classroom and that child is sent home, but other people in the classroom may have been exposed, we are not recommending quarantining all the other kids in the class at this point. We do recommend to people as a best practice, if COVID transmission is high, it's good to wear a mask to prevent transmission in those settings. If you want to be sure your child is not going to be coming home with COVID after exposure, wearing a mask after exposure is a good way to add another layer of protection. But we're not asking those kids to stay home after in-class exposures.
You know, given the infection rate, as far as we know, we talked about the home test not necessarily capturing the full picture right now, or the Department of Health not being able to because of home tests. What is your recommendation? I know it's not mandatory, but, for kids who are going back to school on Monday and teachers as well, for parents who are making these choices, what would you advise?
Cases are high right now, and I suspect we'll see additional cases and more cases going up due to new variants that are coming through. Our last variant report, BA5, was at close to 40%. I anticipate seeing a higher count as we come out with another variant report next week, because that's the pattern we've seen nationally. So I do anticipate some additional increase in case counts. With that in mind, my kids are going to be wearing their masks going back to school this year.
And when we talk about just that whole procedure with students now being back in the classroom, and there's other gatherings that are happening, of course, it's not just confined to the classroom. There's other large school events, assemblies, rallies, things of those natures. What is the recommendation in those situations? Is that still optional? Are you recommending that as larger groups gather, that there should be maybe other restrictions that are put into place?
In terms of best public health practice, I would absolutely wear a mask at large gatherings with the current case numbers that we're seeing. I think that's a great idea. We are not in a place where we're going to be having a policeman outside the door making sure you're wearing your mask. But if you want to take into consideration what are the best practices, what would be the best public health guidance on this, wearing a mask in a crowded setting is still going to be a good way to protect yourself and not bring COVID home to your family.
We've got a question here from Joy. She says, please ask, what is the state plan for wastewater testing? There was a lot of talk about this several months ago. Where are we at with wastewater testing at this point?
We are doing wastewater testing now, and we have wastewater testing happening throughout the state. Right now, sites are still ramping up, and so we're having some limited data that gets posted on the national websites from wastewater testing, and looking to see how we can further expand that.
As we've seen through the pandemic, as these surges have happened, there's also been a large demand for these at-home tests that you speak of, and there have been at times, it's been a struggle to find anybody that has any at-home tests on shelves. Is the department doing anything to help to provide those options should the demand for at-home tests rise again, just to ensure that people have the ability to get tested and have access to those tests should and when another surge come into our community?
Mm-hmm. We really responded to that shortage we experienced during Omicron to see how can we prioritize getting home test kits out in lots of different environments and settings. We've partnered with schools and many community partners, as well as federally qualified health centers, to make sure tests are reaching populations throughout the state and people have access to them when they need them. I was heartened to hear that some of our community members in Hawaiian said they actually had so many test kits at home, they didn't need them from another event that had happened recently. So right now, I feel like the availability has been really good, but we continue to watch that. We want to make sure tests are available especially when surges are happening.
Let's say you do test positive for COVID-19. There are a number of therapeutics that are out there now that we didn't have a year ago, even a few months ago. Can you tell us what those therapeutics are, what the recommendations are, and what are some of the costs associated with that? I think a lot of people, when they test positive at home, they don't really know what to do next and if they should get this Paxlovid or any of the other therapeutics that are out there.
Therapeutics can be confusing. There are multiple choices and options out there. Really good to talk with your doctor. So if you get sick, you think it might be COVID, do a test, do a home test, get tested with your doctor. But as soon as you realize you are positive for COVID, the important thing is to get treatment quickly. It's most effective when given within 5 days of your symptom onset. So you want to act quickly on that. Call your doctor to get the prescription. But you'll find that many people qualify for treatment who may not realize it. There's information on our website. If you go to hawaiicovid19.com and Google therapeutics, there's a one-pager for patients that tells you what things to think of, conditions that might qualify you for treatment. It's more than you might realize. Asthma, being overweight, and even depression. So just to name a few conditions that are pretty common that would qualify you for treatment.
I want to circle back and talk about that second booster shot, because I think there are many in the community who would like to go out and get that second booster shot, but they don't necessarily qualify within some of the criteria that has been set up, be it through age or, not necessarily being someone that is near someone that has an autoimmune disease or deficiencies. What would you say to those who are maybe of the younger demographic who don't fall into that age range but want that second booster shot? When do you think that might become readily available, and your recommendation to those who are seeking this shot?
As we were talking about before, the biggest impacts in terms of severe outcomes continue to be in the older age groups. So right now, the recommendation for the second booster is for those over 50, but also for those 12 and up who may have an immune compromising condition, who may have a weaker immune system. If you're not sure if you fall into that category, you should talk to your doctor because you might be eligible for the booster.
Okay, and let's also talk about the youngest set of our community, those under 5. I know my son's 3. He's gotten his second of 3 shots. We're so relieved that he has some protection now. But we didn't see a mass of, critical mass of parents clamoring for this. What do you say to parents who may still be on the fence about getting their children, the youngest children in the family, vaccinated?
I'm very excited about the availability of vaccine for under 5. We've been waiting a really long time for this. And we have a lot of data now on the COVID-19 vaccine. So we know that it is incredibly safe and effective. Pediatricians, the American Academy of Pediatrics recommend COVID-19 vaccine for children under 5. So I would say to parents who are still uncertain to definitely talk to your pediatrician, get more information about the vaccine so you can make the best choice for your family.
As an epidemiologist, of course, you're not only having to monitor COVID-19, but other things that are happening within the state. And of course, one of the things that sometimes gets confusing with this is the flu and other people just getting sick and having symptoms, but are testing negative, don't have COVID-19. Where do you find that balance between trying to distinguish if you have something like the flu, a common cold, and COVID-19? What are some of the differences in terms of treatment and what people should be doing? If let's say it's not COVID-19, should they still be going to work? Should they be in isolation if it's the flu? I think that there are still some people who are just unsure where they fall if they're not getting that positive result, but feeling some of the symptoms that we see with COVID-19.
The first thing I would say, and we've learned this from COVID, we've always said this about flu, but COVID really taught us this lesson. If you are sick, stay home. So I think that message really is the most important one. If you're having symptoms that might be flu, might be COVID, first of all, stay home and don't expose other people. But also, testing is valuable for both of those conditions. So you want to get tested for COVID. If it's not COVID, you may want to seek flu testing too. There are therapies available for both COVID-19 and influenza that are effective.
There's some questions here about natural immunity, and then there is this sense that, well, I've had COVID, so I don't necessarily need to be, getting the next booster. What do you say to folks? Because there are so many people, who have recently been infected with COVID-19. How soon can they get their next booster? And does having a prior infection give us the kind of immunity that early on, there was so much talk of herd immunity. Now we hear so much less of that.
There's a couple reasons to still get vaccinated if you have had natural infection. One is that, especially with the newest variants with BA.5, we're seeing higher rates of reinfection even if you previously had COVID-19. Vaccine may provide additional protection against reinfection and particularly more severe outcomes from reinfection. Additionally, you want to make sure that you have that long-lasting immune response against severe infection. And that's been one of the things about the COVID vaccines that has really held up, that they protect you. They may not protect you necessarily against getting COVID-19, but they protect you from the outcomes like getting hospitalized, ending up in the ICU, or dying from COVID-19. So getting your shot even after you've been infected is still going to be beneficial.
Can you tell us about looking and studying the other areas and locations throughout the world, if there is anything on the horizon? Of course, BA.5 is really that dominant variant right now, but is there anything that is concerning to those in the medical community about potentially another variant as we continue to see COVID-19 evolve?
I'm constantly going to be worried about new emerging variants from where I sit. That is always the concern. And there's constant evolution of the virus. So we do know that new variants are always out there. What we wait to see is, are we seeing a change in trends? Are we seeing an increase of one variant over others? And then what do we know about the impact of that particular variant? How severe is it? How transmissible is it? So I do think we need to stay on guard.
I'm interested to know, because the policy shift, Hawaii was one of the last states to stop with the indoor mask requirement when it comes to schools. What do you think it would take, or is there any room for that to ever shift back? I ask that primarily because Hilton Rathel of the Hospital Association, spoke out last week basically saying that the hospitals are at a breaking point, and it's not necessarily because of acute COVID cases flooding through the door, but a variety of factors, including staff being out sick, people doing more medical care because they missed so much during the initial phase of the pandemic, and then still a steady march of people who have COVID and are getting pretty sick. What metrics are you looking at? And would there ever be a mask requirement reversal specifically in schools, or that you would recommend statewide?
I think that there's not any single measure that we can point to that would lead to that decision to require masking again in a universal way across the state. But it is something to think about. And I think some of the factors, as you say, it's really an ongoing conversation with the hospitals, their capacity to provide care when people need it. And this is one of the reasons why healthcare settings are going to be distinct from other settings, why masking may still be required for healthcare workers for the foreseeable future. I think that's going to be a new standard for healthcare. Up to date on vaccines for healthcare workers makes sense. There are interventions that are going to be specific to healthcare settings so that we can maintain the ability to respond when we need to and take care of patients and not be spreading COVID to our patients.
One of the other things we know that the Department of Health is monitoring is Monkey Pox. We're hearing of its spread throughout the globe, and the World Health Organization also putting this on notice. What are we seeing with Monkey Pox directly as it relates to here in Hawaii?
We are also dealing with the monkeypox outbreak here in Hawaii. It is unfortunate that our LGBTQ community has been predominantly impacted throughout the nation and in our state, but we are working with those partners to get vaccine out to those who are at highest risk.
If you think you may be at risk, I mean, what is the state sort of supply, if you will, for this vaccine? Have we ordered more? I know that, San Francisco is declaring now a state of emergency because they're seeing, I believe it's about a third of the cases nationwide in that community. What are we anticipating here, and how much reserve do we have of this vaccine?
Right now, our reserves are adequate. We're working with clinical partners throughout the state and providers who serve at-risk communities, and they are starting to vaccinate this week. So we have over 250 appointments scheduled after we opened our call line this week, and that's still going as we continue to take calls. We're monitoring the supply, and we're going to continue to work with the feds to get the supply that we need based on what we're seeing here.
And if you can just, maybe educate our viewers about what some of the symptoms are. I mean, what exactly is monkeypox? How is it spread, and just the impact that it could have on somebody?
Monkeypox, as we're seeing it in this current outbreak, has not been as severe as some of the strains seen previously out of West Africa. However, we are seeing a lot of impact from the transmission of monkeypox, in part because it can be very painful, it can be itchy, it is not a pleasant infection to have. And for some people who may be immune compromised, it can be more severe. So I think it's definitely an important and critical issue. We are fortunate to not be seeing a lot of deaths happening, and none in the US to date.
And what's the treatment? Just forgive my sort of unfamiliarity with this particular virus. What are the treatments available, or do you essentially need to let this ride its course?
There are treatments for monkeypox. They're available through the Strategic National Stockpile. So those treatments can be ordered through your doctor, who would coordinate with the Department of Health to arrange for that treatment to be given.
So if there are individuals out there who feel they may have been exposed, or for somebody that may just want to get this vaccination, I mean, what would that process look like for those who are interested?
For those, right now, we are focusing vaccine on those who have been exposed to someone with known or suspected monkeypox infection, and for those who have recent intimate contact in settings or venues where we know monkeypox is actively spreading. So if you think you might have been exposed in the last 14 days, call our hotline and go to our website for monkeypox for DOH to find out how to be vaccinated.
Okay. I'm just interested to know, we talked a little bit at the top of the broadcast about school coming back, and that happens on Monday. How much of a bump, if you will, are you expecting to see with kids going back to school? What is sort of a tolerable level of COVID infection? I know that no cases would be ideal, but that's not realistic. So what are you anticipating with the start of school?
I do think we'll see an increase in cases with the start of school, not necessarily because of school, but I think we're going to be going into an increase as school opens because of BA5. So I think that's part of why, as you make your choices for your family and your child about masking, it may be a strong consideration to have your child masking up as they go into the new school year. That would definitely blunt transmission. Being up to date on vaccines for your children is also a great way to reduce risk of severe outcomes. So we have a lot of tools at our disposal now. It's a good time to use all of them.
And for those who are looking to get the booster, I know that there was a lot of conversation early on about the different types of boosters, the different brands, from the J&J to the Pfizer's. What would the recommendation be for someone who is going in for their booster? Is it to potentially get the same brand, if you will, that they got with their initial shots? Is there allowable for mixing in? Is there any new vaccines that have been added to the market since this outbreak initially began?
Generally speaking, the recommendation is going to be to get a booster with the same series that you started with, but you can mix and match. In terms of new vaccines, Novavax is a new vaccine that's been approved for use under EUA. Right now, we are working on getting our allocation from the federal government. And once that's available in Hawaii, you'll be able to identify where to find Novavax on the hawaiicovid19.com website.
We're getting a few more questions on monkeypox before we let you go. I want to bring this in from Heidi because this is so new for so many of us. How contagious is it? Is it airborne? Does it live on surfaces, physical contact? I know that you had mentioned intimate contact But I did read about some cases in children, so I'm curious to know what your recommendations are when it comes to monkeypox and staying safe.
While right now the most impacted community has been among gay, bisexual, and men who have sex with men, we know that monkeypox is not a primarily sexually transmitted disease, and it can impact anyone. For pediatric cases that we've heard about, this can occur through household contact. Any close skin-to-skin contact can transmit monkeypox. That being said, the general population is going to be at low risk unless you think you've had close contact in venues or settings where monkeypox is spreading, or are household contact to a known or suspected case.
As we wrap up our conversation this morning, I want to just kind of ask you, for someone that has been on the job now for some time, you came in the middle of the pandemic and had a lot thrown at you to kind of catch you up to speed to assume this role. How have things been for the department as you navigated through and this phase that you all are in right now as we have evolved on into this phase of the pandemic?
I'm sorry, can you repeat that one more time?
Yeah, I just kind of wanted to, I guess, get your sense of how things are operating, within the department. We know that you guys were stretched pretty thin during that time, and especially for someone like you, coming in new to this situation, not and having, kind of had to catch up to speed. How are things? How are you guys managing things as a whole as a department now, with everything that is going on?
It's definitely busy at the Department of Health right now, managing both ongoing COVID response. It definitely not done with COVID yet, and also now monkeypox, plus other infectious conditions. As people are getting back to their usual routines and activities, we're seeing more foodborne disease, we're seeing Legionella, many of the other infectious conditions that have always kept us busy in the past. So we're definitely looking at what are the what do we need to build? Where do we need to build capacity? What are the things we need to be advocating for in terms of a more robust public health infrastructure in the state? Working a lot in advocacy through some of our national organizations and other jurisdictions to make sure that Congress hears what is really needed for a robust public health infrastructure in our state and throughout the nation.
And before we let you go, just a final thought to our viewers today. I know that you mentioned throughout that, the pandemic is not over. There is a sense that people are over COVID. COVID's not over us. So what's your final message to folks as we navigate through this part of the pandemic?
As far as COVID goes, there's a few simple things that you can do to maximize protection. Get boosted, get up to date on your vaccines. Check out the therapeutics website and understand if you would qualify for treatment if you do get sick. And most importantly, stay home if you're sick. This is a new standard, I think, for all of us, that when we feel sick, stay home, don't expose other coworkers, students, and those that you work and love with, in your life. So thank you.
All right, Dr. Sarah Kemble, thank you so much, State Epidemiologist, for updating us on where we're at with COVID-19, as well as with monkeypox here in our community. Always a pleasure to have you on. We look forward to speaking with you again sometime soon. Mahalo.
Thank you so much for having me.
Thank you. Good to hear from her, and thank you all of you who are putting in your questions into the chat. We always try to incorporate those in our conversation as much as possible. We hear the same messaging again and again, but it is so important to remember that even though masks are not mandatory anymore, her recommendation is that if you're in a crowded indoor setting to still keep yours on. She said that, parents have the choice now when their kids go back to school on Monday, but her kids, on a personal note, she said, will be going with masks, and that is a recommendation that she makes to others. Of course, it's not mandatory anymore, and there are some changes to the quarantine requirements as well. If kids are exposed in the classroom, the whole class does not need to shut down. They can still attend school. But Ryan, she did say that they are anticipating a bump in cases with school starting, and also just more community interactions.
Yeah, it will be interesting to see how many of these students, when they arrive to school, will be wearing masks, what the overall comfort level will be for teachers as well, if they will be ones that will continue to wear their masks. But again, this is somewhat of a significant moment here in the pandemic where schools will now have this option of going with or without masks. We also got an update on boosters, and sadly still 22 people reported that lost their battle with COVID-19 here in the state of Hawaii within the past month. And so you heard from our state epidemiologist continue to encourage people to get that booster if you have not already gotten one, and then also encouraging those who qualify for that second booster to go out and do that as well, saying that many may be waiting for the super booster, if you will, that will kind of cover the new variants that we're seeing in our community. But that has not been confirmed just yet. And rather than wait for what could be coming down the line, the Department of Health encouraging people who do qualify for boosters to get them right away rather than waiting for what could potentially come down the line.
Right. And she also encouraged parents for those kids under 5 to go out and start their primary series of vaccinations. Only 45% of kids who are eligible in that age range have actually started their vaccination series. She says that can make a huge difference. Of course, preschools are also going to be going back soon. So those are the kids that could be very vulnerable if they are not vaccinated. She also talked about therapeutics. There are a number of ways that you can treat COVID and lessen the infection if you do happen to test positives. The Department of Health has a whole page devoted to therapeutics and the options that are out there. So we have a lot more tools in the toolkit, but she did say they're only effective if we use them. So it was very interesting to hear from her. We're going to continue our conversation on COVID-19 on Monday with Dr. Tim Brown of the East West Center. He does a fantastic job of monitoring what's happening around the world and can give us some insights on trends. He's also going to update us on Monkey Pox as well. So we're looking forward to having that conversation with him on Monday. Until then, we hope you stay safe and have a great weekend.
We'll see you on Monday. Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.